Hello, everyone. Welcome back to Coffee and Childbirth. I'm sure you can notice this is not Dr. Kelsey. And we have an amazing, I'm so excited about this conversation. We have our amazing Dr. Mary Ann Martin, also known as a Dr. Hormone Hacker. So we're here with her. We're excited to have you. Obviously, we're going to talk about some children's stuff, some birth stuff, but mostly about diabetes, and that's what you're an expert in. So we're excited to hear all about it. So please tell us a little bit about you.
So I want to share, first of all, how Dr. Hormone Hacker actually came to be.
Yes, please.
And it was really a very personal reason. I chose endocrinology, I must confess, because I hated every other specialty. And as I was rotating through, endo was the last possible chance for me to pick a specialty. And I kind of knew my personality. I can't be the jack of all trades and know everything from head to toe. I applaud you because I can't do what you do. But I knew if I could just specialize in something and be really good at it, that's where, I can shine.
Yeah.
And so thankfully, I really loved diabetes. And I was warned ahead of time from my colleagues, you are going to really hate endo because the diabetics are very complicated. They're on 15 different medications. Yes. They're non-compliant. They'll lie to you what they're eating, and so I had zero expectations. And I ended up falling in love with the diabetes clinic. And I really enjoyed hearing their stories.
Got it.
But here's where the hormone hacking comes into play, is that when it comes to diabetes especially, many times when you go to get your physical exam, they'll at least do a fasting glucose.
Sure.
Which I like to say, that is a Polaroid snapshot of what your sugar is at that moment in time.
I love that.
But
I love
here's
the
the
way
thing.
that you explained that. Yes.
If you're on the road to get your blood work done and there's an accident and you're stressed, you arrive and you're still breathing hard, your glucose is going to be at least a few points higher. So it can be falsely elevated. There's lots of outside factors that can make the number different every single morning.
Right.
Okay. Right. So it's a very rudimentary test.
Yes.
The second thing, which most people will order for you, is an A1C, which is the 2 to 3 month average of your sugars.
Yes.
Okay, great. But you can cheat. And I've seen it. Because what happens is, if my patients know, okay, so this is a 3 month average. All right, so I'm going to just go crazy from Halloween until New Year's Eve. I'm not going to schedule my blood work till the end of February because I can be really good January and February, and then she won't know what I did December. And you can do that.
Right.
So I don't like just stopping at glucose and A1C. The third test that everybody misses is a fasting insulin.
Okay.
That one can actually predict the risk of diabetes 7 to 10 years sooner than glucose and A1C. So when I really learned about how hormones work and that we're not hacking them in the right way, and also I need to explain it to the patients in a way that's simple, relatable, and actionable.
Absolutely.
And so that's really where Dr. Hormone Hacker came from.
Well, I know you have a book coming out soon.
I do.
And I'm so excited to see it. The name of the book was interesting because it's Patient Zero, was it? Right?
So it's the type 0 diabetic, my experience as patient 0.
Gotcha. So you yourself as a patient.
I was.
Got it.
Yes.
Because you look like the picture of perfect health.
And that's the biggest deceiving fact, is that you can't tell just from the outside what's going on the inside.
And I think there's a lot of diseases like that as well.
There is.
Yes.
Yeah. So that's why I say you have to test, don't guess.
Yes. Oh, I like that.
Yeah.
Test, don't guess. So there's lots of different kinds of diabetes. Can you kind of go over that a little bit, just in general, what we're dealing with that?
So in your population, moms are going to be most interested in gestational diabetes.
Absolutely.
And then we've got type 1, which is generally diagnosed early on in age because it's an autoimmune condition. Then we have type 2, which actually is getting diagnosed earlier and earlier.
Oh, wow.
There are kids that are 10 years old being diagnosed with type 2.
Wow.
Yeah. And then there's even type 3, which is related to sugars in the brain. So Alzheimer's is a type of type 3 diabetes.
Yes.
So that was the whole concept of the book was, well, why can't we get back to zero?
Gotcha. That's very, very interesting. So, type 3 isn't something that most people are aware of either, which we can probably touch on a little bit. I would love to go back to the conversation about moms, because that's obviously Dr. Kelsey and I, we both see a lot of moms in our practice. And we would love to know more about how the gestational diabetes is affecting our population, our demographic, our strong, warrior moms that we have, and one of the big things is that they seem to be, again, right, this facade of feeling healthy, and then they go in for a checkup, and then now they've got this news that they have gestational diabetes.
Yep, exactly. So that's where I really want to start, is as soon as a woman is even thinking, I might want to start getting pregnant.
Yes.
That's the time to actually get tested.
Thank you. Yes.
Okay. So again, most of the time when you go, please make sure they're ordering a complete hormonal panel so that you have the best clues of your future destiny.
Yes.
Okay. And then what I find a lot of times is they're not ready to make a change in either nutrition or whatever until they're actually pregnant.
Correct. And even after that,
yeah,
they're like
exactly.
Still stubborn.
Yeah.
I had moms stubborn. Yes.
So everything, the earlier, the better, because the truth of the matter is you can look at statistics and be very depressed or be very, very empowered.
Right.
And so one of the things that's shocking that I don't think a lot of women know is that if you have gestational diabetes,
like during pregnancy,
you have a 50% chance of developing type 2 diabetes.
Oh, yes.
That's huge. You have 2 women with gestational diabetes. One of them is going to get diabetes in her lifetime.
Yeah, 1 out of 2.
Okay. But here's the encouraging thing. Is that most women, if they start early with nutrition and exercise and stress management and sleep prioritization.
This is prior to pregnancy you're talking about?
Well, even during
it.
So prior is best, but even during the pregnancy, if they start on all of those lifestyle measures, 80% of the time, they don't need medication. And so most of the time, if they do need medication, it's either metformin.
Right.
Occasionally, though, it might be insulin.
Yeah.
So if you don't want to take multiple shots during your pregnancy, the time to really, make a change is when you first think about it.
So what would happen then? So can you just walk us through with the process of how the actual gestational diabetes is being diagnosed in situations with certain moms, please?
Well, first of all, the protocol, I feel, is too late.
Yeah.
Because they're not going to see the OB until about maybe 8 weeks, right?
True.
They're going to wait for a missed period.
Sure.
So, and then there might be a wait to see the OB.
Right.
So the first visit is probably towards the end of first trimester. Okay. Then you need to have your OB order the blood work.
Right.
Now we're talking middle of second trimester. That should have been done even before you got pregnant.
Okay.
So that's one thing that I would love to change.
Yes.
Is, again, you need blood work even before you get pregnant. Right. But as it is right now, most women are ordered a glucose tolerance test.
Yes.
Which is awful because you have to drink this.
It is.
It's the nastiest, sweetest drink. Yeah. But
thank goodness I haven't had to do it. But I've had so many moms just dreading the process.
Oh, it's awful.
Right? It's just awful. The taste of it. They don't feel good afterwards.
It's actually worse than the colonoscopy prep.
Oh, that's next for me, actually. So I'm not looking forward to that.
But anyway, so it's a 2-hour test. Their sugar levels are tested before they drink the orange soda, and then 1 hour and 2 hours after.
I see.
And so from there, it will be decided, is there gestational diabetes? And if there is, how serious is it? Can we start with lifestyle, or does this require medication?
Right.
Now, throughout the pregnancy, with good prenatal care and, lifestyle changes, everything goes well. You have a normal pregnancy. Don't forget to get follow-up blood work,
Of course.
6 to 12 weeks later,
Mhm.
right? Which a lot of women skip because they're taking care of a newborn.
Sure.
They're overwhelmed. They forget,
Yes.
or they don't want to.
This is postpartum care.
Yes.
Very important.
Just as important as
Yes.
prenatal care.
100%.
Yeah.
Yes.
So here's where I completely disagree with the current guidelines.
Oh, yes. Please tell us.
Okay. Right now, it is stated that if you go 6 to 12 weeks postpartum and your sugar levels are normal, and I'm assuming they're just talking about fasting glucose, maybe A1C, but mostly fasting glucose, that you shouldn't really need to be checked for another 1 to 3 years.
1 to 3 years.
1 to 3 years is the recommendation.
I didn't realize it was 1 to 3 years. I just assumed that it'd be within months.
Right.
Again.
So my personal way of doing things is anyone with GDM should be checked no less than twice a year. It doesn't even matter if it was normal, because the biggest risk for a woman who has had gestational diabetes to develop type 2 diabetes is within the first 5 to 10 years. We have to be super aggressive at testing during that first 5 to 10 year period.
Wow. Okay.
And then the reward is, okay, if you've had normal sugars for 5 years in a row, like twice a year.
Postpartum.
Okay, we can relax.
Right.
Like maybe once a year.
Yes.
Okay. But the first 5 years at least should be no less than twice a year.
So do you think that, let's say that they test negative, right? Postpartum. Do you think that there is still a chance for them to develop diabetes maybe 5 years, 10 years?
Yeah, so that's the problem, is that we're looking at the entire lifetime of the woman who's had gestational diabetes, 50% risk in her lifetime. I don't know when that's going to happen. Is that going to happen in the first 5 years? Most likely, but it could happen in 10 years, 20 years. You know, it takes one injury where you're sedentary, you start gaining weight, and there you go. You're falling off the cliff.
It doesn't take a whole lot, for sure, especially if you're highly stressed and you got, you know, a toddler or two, maybe even 3. Here, I've noticed maybe even 4 or 5. I've seen that.
Well, I'll tell you what else happens is you start eating whatever your toddler's eating.
Yes.
That's a big problem.
Absolutely. Yes. So how do we, so now maybe we should talk about then, I'm thinking, I'm going to try to think about it from a patient's perspective, right? Because I try to do things as close to what I understand and what I've learned over the years to be healthy. But I don't have a toddler wanting, you know, popsicles at 8 o'clock at night or cookies. Like, I don't have, this one doesn't care what wants what I eat, honestly. And she probably eats way healthier than I do too. But I would say, from a mom's perspective, what would be like the most practical advice that you can give her once baby's born and you're having some of these struggles at home, because now you're trying to deal with not just having a newborn, maybe even a toddler, but also now you've had gestational diabetes during pregnancy. So what is like the most, you know, practical way of going about it? Do we go back to our OBGYN? Do we need to have a different doctor to go to? Do we have them talk to each other? Does that happen? So I guess in that perspective, I'm kind of curious what to advise.
You know, a long time ago, there was the promise of having an electronic record with you, like a CD that you could take to all your doctors, and everyone just downloads the information. That's probably not going to happen.
Right.
So yes, in a perfect world, all of your providers are communicating with each other, but you still have to be your own best advocate.
Yes.
Right? But as far as what busy moms who already have one or more children, what they need to prioritize is, number one, really asking for support. And I think especially because we feel like we are super women. We can do a lot, but should we? And for how long
I like that.
Should we?
Right.
Right?
Right.
So for a short period of time, yeah, you can be under high stress and be okay. But for a prolonged period of time, like if you're under constant stress for more than a week, that's too long. And you need to ask for help and support.
Right.
And I think a lot of people also feel like it has to be perfect or not at all. So either I eat really, really healthy, or I'm just going to wing it.
Uh-huh.
And they don't give themselves the grace to say, all right, it's going to be messy.
Right.
There's going to be some choices that I make that are amazing,
Right.
and some that it is the best I could do at this time, right?
Yep.
But the more that you can prepare,
Yes.
some days you might only have 2 protein shakes a day because you don't want to cook.
Yeah.
You're not at home. You know
Right.
what I mean? Like, you know, so maybe that was the best that you could do that
Right.
day.
Yeah.
I wouldn't want you to do that every day.
Right.
But, you know, and another day you might go to Chick-fil-A, but order a salad and grilled chicken nuggets. I don't have a problem with that.
Okay.
Right?
Yeah.
So it doesn't have to, you don't have to be like
Yeah.
the Instagram super mom
Right.
who's
Everything's
cooking
perfection.
and gardening
Yeah.
and fresh herbs. You know, it doesn't
Right.
have to be like that. And it
Sure.
probably won't be like that.
Sure. So that's so funny because the other day I had a patient that came in and just a case of so she's been monitoring her own sugars, and she had the glucose tolerance test, and it came out to be positive. The doctors are like, oh, no, we got to do something about this. We're gonna do some fetal monitoring, and twice a week they asked that, and she said, I feel like that's just excessive. And then she's like, but my numbers at home are within normal. But when I come here, I get a positive, and now everybody's freaking out. And then that same patient actually had Chick-fil-A salad with chicken nuggets. That's so funny that you said that. And I gave her a little bit of a hard time last time she came in, and I said, did you have the sauce with it? What kind of sauce did you put in there? What kind of dressing did you put in there? But so what about the home self kind of testing versus what happens when we are actually getting tested? So what's going on with that?
That's such a good question, because you've heard of white coat hypertension, right?
Yes.
Which is why
I get it, and I didn't even wear white coat.
Okay, so you're going to laugh when I tell you
Yes.
this, but ever since I graduated,
Mhm.
you know, from my fellowship, I never wore a white coat again.
I love
Because
that.
I never wanted a patient to blame that as a reason. So I'm like, no, you don't have that excuse.
Yeah.
I'm not wearing a white coat. But it's a real phenomenon, not only for blood pressure, but for blood sugars as well.
Okay.
And so many times I trust the home monitoring numbers more than I do when it's done in a clinic setting where people are not comfortable.
Yes.
They've, you know,
It's
again, had to
stressful
drive.
to get there.
Exactly.
Yes.
And who knows how long they waited.
Right.
And they're annoyed.
Yes.
You know, so definitely. That's why.
Can you repeat that one more time really loud?
Yes. The more data you can collect at home and bring it to your provider, you have more of a case to say,
I love that.
This is what's really going on most of the time. You're catching me at a 10-minute interval of my life.
Yeah.
Here's what's going on the rest of the time.
I love that.
But the provider also has to be open to trusting that data.
Yeah.
Right?
Yeah. Oh, that's another podcast. That's another episode. Right. Well, I'm glad that you said that, because I said the same exact thing to that patient, and I was hoping you would say the same thing. So I feel like that was validated. You're the expert in this, and I hope that patient is watching this episode, because I think she's also going to feel much more at ease hearing that from you as well, because she was very concerned. She was actually very concerned. So I have all these situations with patients that obviously it's case by case, right? We can't generalize all of our patients, but I think it's really a disservice when patients' voice are being dismissed, right? And like I said, you know, what's happening at home day to day, and the more data that you collect, I love that you said that as well, because I think patients feel quite a bit insecure, or maybe because I don't know enough, I'll just go with that. And that can really turn the corner in a bad way at times, I feel like.
Absolutely. Just imagine if you did have elevated blood pressure coming to your provider, and it's only in that situation, and they prescribe you a blood pressure medicine that you take at home, and now you bottom out.
Yeah.
So
exactly.
It's
what causes, I guess, insulin in a pregnant lady, pregnant woman, to misbehave in a way? Just is it happening because the fact that now her body's providing nutrition for not just for herself, but also for the baby? Like, what causes that glucose and the insulin struggle to happen, especially on a mom who seems to be eating pretty, healthy, has a decent lifestyle, like on an average, pretty healthy person, never had an issue with sugar, right? So what happens when that happens?
Well, first of all, I'm going to tell you that's actually very rare.
Mm.
So I can probably count on one hand
Mhm.
how many women who have really taken care of themselves even before they got pregnant
Yes.
and done all the right things
Mhm.
that actually have
Aha.
gestational diabetes.
Okay.
So the women that I take care of that have GDM,
Mhm.
it's because they have not focused on their health for quite some time. And now they're pregnant and they have a lot of catching up to do.
Got it. Got it. So it's really rare for that to happen. Okay. So I'm going to go back to some of my thoughts again in regards to some of the cases that I remember seeing. And I think I'm going to agree with you on that because it's patients share what they want to share.
Yes.
Right, everybody?
So just so you know, it has to be a mutual relationship
Yes.
where,
yes,
I think, though, you probably have an amazing relationship with your patients, which then spurs them to feel comfortable to be
yes.
truthful,
Yes.
right? Because we can't help you
Yes.
if we don't know what's going on.
Yes, absolutely. Yeah. And I think it helps me that I see them so often.
Yeah.
Right. So as a chiropractor, I have to see them usually if they're pregnant, I'm going to be seeing them about twice a week until they give birth. And then we'll talk about it right after birth as well. But I think that is an interesting point that you say that from your end as well, because the relationship, I think, is really key. So if the patient is only providing only certain amount of information, how, as you as a doctor trying to assist them throughout their pregnancy, how do you kind of go about that to get them to, is there any tricks to kind of like getting them to like open up and like, hey, this is how I'm going to help you? Because I do have that struggle with some of my patients with gestational diabetes because they feel shame. I feel like sometimes.
Right. No, this is the whole Jerry Maguire thing. Help me, help you.
Yeah.
I really think it does take time
Mhm.
to develop that trust
Mhm.
with certain people.
Yeah.
And the more that you can, just like you said,
Yeah.
make sure that they know this is not something that we're judging you.
Yes.
This is not a shameful thing. This is just me trying to partner with you.
Right.
So you have the best, healthiest pregnancy,
Love that.
not just for yourself,
Right.
but for your child.
Yeah.
Because here's what happens for the child. The child of a woman who has gestational diabetes
Yes.
has 5 times the risk of
Question.
developing diabetes, right? So
right off the bat, you're
right off
saying
the bat,
as soon as they're born,
so
the chances are
compared to a child born without a woman
Yes.
having gestational diabetes.
Wow, that's a lot more than I had anticipated.
But so that's where some of the conversation has to be is, look, yes, you're doing this for you.
Yes.
But more importantly, what kind of legacy are you leaving for your child?
Absolutely.
Like, we got to get this together.
Right.
And let's do this together.
So do you think is there a lot of incidents where it gets missed too during the pregnancy, like the diagnosis?
Only if the person doesn't show up to their appointments.
Okay, so if you test, for sure.
Yes, but again, by the time you see the OB, it's too late.
Okay.
Right? I mean,
yes,
it's not too late to make an intervention and control the gestational diabetes.
So that's management, though.
Exactly.
Just management.
That's not
right?
prevention.
Correct.
Yeah.
So in your, ideal world, if you had full control, because doctors don't care about control at all, right? If you have full control of all of your patients, decisions in regards to GDM, and it's in this perfect ideal world that makes sense to you as a specialist, how would that look like for them to, you said it was before they even think about it, like what would it look like in steps, so that maybe if this helps any of our patients, then they can be more of an advocate and be like, okay, I'm thinking about getting pregnant in the next few months. What do I do now? And I want to follow this protocol by Dr. Hormone Hacker.
Well, so I'm going to tell that person
Mm-hmm.
a very similar thing that I actually share with women who have thyroid disease,
Ah.
which is as soon as you find out
Mm-hmm.
that you're pregnant, don't wait until you see the OB, okay? But when you find out that you're pregnant, if you have thyroid or if you're, just a person who wants to have a healthy
Mm-hmm.
pregnancy, you call me
Mm-hmm.
and we're going to order blood work for you immediately,
Uh-huh.
like that week.
Okay.
And it's important for your audience to know
Mm-hmm.
that if they have thyroid, of course, during pregnancy, their dose is probably going to go up.
Uh-huh.
And then right after the pregnancy, it usually comes back down to what it originally was.
Uh-huh.
But in a perfect world, just like you said,
Mm-hmm.
what it would look like is, oh, I think I might want to have a child.
Yeah.
I'm starting to have conversations about it with my partner.
Right.
I need to call Dr. Hormone Hacker.
Mm-hmm.
Okay.
Yes.
They call me. I'm going to order blood work for them.
Yes.
They're going to get fasting blood work done within the week.
Uh-huh.
I'm going to go over the results with them.
Right.
If everything is normal, awesome.
Great.
Amazing. Continue what you're doing.
Yeah.
And let me know when you're pregnant.
Ah.
Can't wait to celebrate with you.
Okay. So when you say when you're pregnant, within the first...
Yeah, as soon as you know.
Okay,
so,
as soon as you know, you call.
As soon as you know, let me know. We'll recheck it. And just to make sure all the hormones that are changing during pregnancy aren't affecting your sugars.
And we're not talking about just like hormone, like insulin, but we're talking about all your hormones, right, Doc?
Thyroid, everything.
Okay.
Exactly.
Okay.
Then if the scenario is the glucose, the insulin, or the A1C are even borderline, this is my biggest pet peeve. Let's say you see a person and their fasting glucose is 98. Not going to be flagged.
Right.
Because it won't be flagged until it's 100.
It's not in that range.
Correct. I'm all over it.
Yeah.
I'm like, do you know how close you are to prediabetes?
Exactly.
We got to do something now.
Yeah.
Right? So I look at the numbers and I will then either say, again, you're doing amazing, or your sugars, your insulin, your A1C is a little too close for comfort for me. Let's start implementing some changes right now so that when you do get pregnant, you're going to have the best pregnancy ever.
Gotcha. What are some of the early symptoms then that moms should kind of like see or listen to once they're pregnant, right? And they haven't thought about, oh, I'm going to get tested. I won't get tested until later, so I'll just wait until that. But what are some of the day-to-day symptoms that they can like look out for?
Well, the first thing that I want to say is it's usually asymptomatic. So if they're feeling symptoms, that's really bad. Okay. Because they're very far along.
So it's one or the
in
other,
that gestational diabetes spectrum. And that is, I think, if you had a disease that your body told you about early on, of course everybody would be on it, right? True. It's much harder to do something in the future when you don't see the payoff.
Gotcha.
Yeah. And so I would say that for someone who has a family history, their mom had gestational diabetes, an aunt, a grandmother. Okay. So we're not just talking type 1 or type 2 diabetes, gestational diabetes, but also ask your family, your female relatives, has anyone had a baby over 9 pounds? That's a risk. That's definitely a risk.
I was a 9-pounder. I think my sister was about 10 pounds, and my mom is a small little lady. So, wow. Yeah. Back then in Korea, I don't think they checked any of that stuff back in the days.
So that's why you can't rely on a family history of blood work. Gotcha. Because again, like in my parents' generation, nobody checked insulin.
Right.
There wasn't even a thing.
Yeah.
And hardly anyone got an A1C. They just got a fasting glucose. Right. But back then, also, it wasn't even flagged until it was above 130. So it's unreliable. But you can actually, measure, okay, do 9-pound or bigger babies run in our family? Yeah. That's a big risk. Okay.
Well, that's great to know.
The other thing is if the person who is thinking about having a baby isn't a good water drinker, this is your time to improve your hydration.
Man, hydration is like key for everything.
It really is.
It is life.
It is.
It is really
and
life.
What people don't realize is just being well hydrated already brings your sugar levels down a little bit.
Wow. Wow. Well, so the hydration is very key, it sounds like. History, right? So not
Yes.
always blood work history, but
Yep.
just family history of
Yep.
just stories, maybe asking for some story. Would it ever be related to what's happening on the dad side with the gestational diabetes? Not so much.
Not so much.
Okay.
So unless there's a strong family history of type 2 diabetes on the dad's side, that actually affects the child, but not
so
the
much
mom experiencing gestational diabetes
I
or not.
see. I see. Well, is there anything else that you would like to share? Any tips, secrets, or anything like that before we end this episode?
Yes. What I want to leave your audience with is
Yes.
this. Number one, don't be afraid to check. It's never too early to check. Check often.
Mm-hmm.
And here's the most important thing.
Yes.
Go to a provider who actually interprets your labs in a preventative and holistic manner.
Yes. Agreed. That's hard to find. But I'm glad that you're here. So thank you, everybody, for joining us for this episode. There will be more to come. We're going to have part 2 with Dr. Hormone Hecker, and we're going to talk about kids and type 1, type 2, maybe even 3. So thank you so much, and join us next time.